Thanks for your company this afternoon. Now, I want you to have a listen closely to the story I'm about to bring you about an incident that has happened in the last 48 hours at Blacktown Hospital. We all know that when a woman delivers a baby, there are usually lots of people around to assist. Doctors, nurses, midwives, family, whether it be at a hospital or elsewhere. But imagine having to give birth to your baby in a hospital all alone, delivering the baby yourself. Because believe it or not, this is what has happened to a Sydney woman at Blacktown Hospital yesterday. Early in the morning, she woke up in a lot of pain and began giving birth, but there was no one there to help. It took some time for the nursing staff to attend to her, and this all happened after she had finished giving birth to the baby. It's not the first time Blacktown Hospital has been in the news for performance that is below par. I want to make it clear this afternoon that any criticism of Blacktown Hospital is not directed at nurses or doctors or any of the staff members there. But it's been clear for a long time that Blacktown Hospital is underfunded by a long shot. In December 2012, the hospital was rated in the bottom 10% of the whole country when it comes to performance. But this story is a shocker, the details of which come to us courtesy of Channel 9's Amelia Ballinger, who has unearthed the details for Channel 9 News tonight, and I'm thankful that she's decided to share it with us here first. Amelia Ballinger, good afternoon.
Hello, Ben. How are you?
I'm okay. Let's take it slowly so everyone can get the detail, and I know that you have spoken directly with the mother involved. Just take us back to tomorrow, to yesterday. What happened?
Look, well, it actually started the day before on the Tuesday. Christy, who is the mum, actually turned up at Blacktown Hospital about 8:30 in the morning in labour. She went straight to the birthing suite, which is where most new mums head. They tried to send her home at about lunchtime, telling her that she wasn't anywhere close to having a baby. She was in a lot of pain. She didn't want to leave, and she told them just that. They insisted she wanted to stay. In the end, they moved her up to a maternity ward.
So was she in labour at this point?
She's in labour at this point. So she's turned up to the hospital in labour. And they thought she was a long way off birth. They've actually sent her to a maternity ward, which is not where you need to be if you're going to have a baby. But nonetheless, she was sent up there. And about 2:15 the next morning, entirely on her own, she delivered her own baby.
Okay, just slow down for a moment, because when she was moved, she had family members with her. What happened to those family members?
Look, she did, and those family members and a friend stayed with her until about 11 o'clock at night. At that point, they were told by staff at the hospital that visiting hours were over and that they weren't allowed to be in the ward with her. They've obviously insisted this woman's in labour, we don't want to leave, but they were told they had to go. So she had no support network there with her. She was entirely on her own. She tells us that staff at the hospital weren't monitoring her regularly. She asked several times for pain relief. She wasn't given very much, she tells us. Throughout the whole 18-hour ordeal, she tells us she was given just 4 Panadol and 1 Endone. And at one point, she actually had to take Panadol from her own handbag to relieve some of that pain.
She took Panadol out of her handbag?
Because she couldn't get any from the hospital.
Why was she not in the birthing unit? I don't understand why she wasn't in there. Was it full?
Well, she tells me that it wasn't full. They had beds. They just didn't think she was ready to give birth, so they moved her upstairs.
She was convinced, though, that she was about to give birth.
Well, she didn't want to leave the hospital. She's in labour.
Now, this has been backed up not only by the mum involved, Christy, but also by another mum or another woman who was in the room. Explain what happened with the others in the room.
That's right. Well, there were 2 other women in the room with her. A lady who was in the bed across from Christy actually woke to the sounds of Christy in pain. She hit the emergency button, thought it didn't sound right, got up and had a look, and at that point she found Christy on the bed having just given birth. The baby's actually face down on the bed in amniotic fluid. This woman has had to pick the baby up, get it breathing, get it crying, and she says it was another 5 to 10 minutes before nursing staff made it into the room to help her.
So when Christy gave birth to the baby, she has facilitated all this on her own? Entirely
on her own.
What did she say about what that was like, giving birth without anyone there to assist?
Oh, look, she's completely shocked, as you can imagine. Obviously, childbirth is not an easy thing to do at the best of times. This is a woman who's in a lot of pain who tells us she hasn't really had any pain relief, and she's just had to do what she had to do. She, as I said, is very, very shocked by it all. The other patient in the room said when she got to the bed, Christy was obviously in a lot of shock. That's why she had to step in and try and get this baby breathing. And she's completely traumatised by what has happened to her.
Were they not able to call for assistance from anyone else in the hospital?
Well, they did. When the patient heard Christy, I guess making some noises that didn't quite sound right to her, she's hit the emergency button. Another woman in that room actually started yelling for help, but they tell me it was another 5 to 10 minutes before anyone got in there with them.
Was Christy conscious of the fact that the birth was happening at that time? Because if she was in so much pain and had been ignored, allegedly, along the way, did she know that this was happening at the time, or was it only afterwards that she realised, hey, this has happened?
Well, she knew that her contractions were quite close together. She says a staff member told her a little bit before this to time her own contractions, which she was doing, but it just got to the point they were so quick she couldn't be timing them anymore. And then she said she just felt the need to push, and that's when it all happened. She said she was screaming out in pain. She was screaming out, the baby's coming, and still no one came to her aid.
And the point is, she's in the wrong part of the hospital.
Well, she's in the wrong part of the hospital, that's right. I mean, anyone who's having a baby should be in a birthing suite. We haven't actually got a response from the hospital yet. We've been trying to get hold of them all day. I think they are going to speak to us now, so hopefully we will have some more details from them and what their response to all of this is on the news tonight.
You let me know if you've got to run, because I know you're at Blacktown Hospital and you are about to interview someone from Blacktown Hospital, so don't be afraid of letting me know if that happens right now. But in the meantime, I'm just going to play you. Now, this is the lady who was woken up by the moans coming from Christy, who was in pain. Let's have a listen to this lady who was sharing the room with Christy.
I woke up from my sleep and I could hear her moaning, and it became quite loud and didn't sound right to me. Baby appeared to be, for what I could see, in a breech position and in a face-down position on the bed in the amniotic fluid. Yeah, so I just took it out of the fluid and gave the baby a rub, wrapped it up with some towels.
I'll tell you what, Christy was lucky that this lady was there in the room and able to help.
Oh, yeah, look, she's completely grateful that woman was there and woke up and was able to help her. And you can imagine that woman, she's actually an expectant mum. She hasn't given birth yet. So to be faced with something like that, as a woman about to have a baby in that hospital must be pretty frightening for her as well.
That lady we just heard from, she was the one who then called to say, can someone get down here and help? How long did it take for the hospital staff to get to them?
She actually hit her emergency button before she even got out of her bed to go and help Christy. So she hit that originally, and then another woman in their room was yelling out to help. They say it was about 5 to 10 minutes before anyone helped them. And I just think it's worth pointing out, I have been into that ward. The nurse's station is about 20 steps from Christy's bed.
It is a shocker of a story. How is little bub doing? Boy or girl, by the way?
It's a little girl, and look, she's good, despite everything that's happened with her arrival. Christy's doing okay as well. As I said, she's really shocked by it all, and she is, fairly traumatised. I don't think anyone expects childbirth to be easy, but it's certainly a really, really bad experience.
Not at all. Do we have a name yet on the little girl?
No, we don't yet.
Okay, Amelia, I'll let you go, and we'll see it on 9 News tonight. Thanks so much for sharing the details with us.
My pleasure. Thanks, Ben. My pleasure.